So good morning, everyone, and you are all very welcome to this morning's Enterprise Ireland Evolve UK panel discussion. It's a pleasure to have you all joining us this morning. My name is Peter Wade, and I'm a Market Executive for Enterprise Ireland UK, focused on digital health. I work closely with my colleague, Mary Claire Henry, Senior Market Advisor, who leads on the healthcare and life sciences sector in the UK. I'm delighted to be joined today by an exceptional panel of digital healthcare experts and Enterprise Ireland clients who will give their advice and insights on the opportunities and challenges facing Irish digital health companies looking to navigate and access the NHS. Before I introduce you to our panelists, I noticed that there is quite a diverse mix of attendees joining us today, so I might give you an introduction into Enterprise Ireland for those of you not familiar with what we do. So Enterprise Ireland is the Irish government agency responsible for trade and innovation. We support over 5,000 Irish companies to grow and scale in global markets. We help our clients start new businesses that will create Irish employment and generate business overseas. We do this through our head office in Dublin and 40 international offices across the globe. Here in the UK, we have 2 offices, one in London and one in Manchester, where our sector specialists support Irish companies with market intelligence and knowledge, identify possible opportunities for our clients, and work closely with leading UK and global organisations to facilitate the introduction of innovative Irish suppliers with the view of building long-term, successful business partnerships. Enterprise Ireland has also been recently recognised as the most active venture capital firm globally in 2020 by leading international investment platform PitchBook, with digital health being one of the key areas of investment. As many of you may know, the UK is Ireland's largest single trading partner, and despite the challenges and uncertainties presented by COVID-19 and Brexit, the UK remains a vital strategic partner for Irish companies. The UK also offers Irish digital health companies an unrivaled opportunity to enter and scale across one of the world's oldest and best performing universal healthcare systems. However, the NHS is notoriously complex and difficult to navigate and is made up of a multitude of organisations and bodies that span both national and regional remits. Sifting through these organisations and making sense of the role they play in digital health ecosystem can be a confusing task for innovators. However, it's hoped that today's panel discussion will provide Enterprise Ireland clients with invaluable advice and first-hand experience on what it takes to successfully navigate the system and supply your product into the NHS. So just some quick housekeeping before we get going. Our webinar will be recorded and a copy of the recording will be sent out to you in the coming days. The panel discussion is also the third in a series of webinars exploring the UK healthcare sector. And I would encourage you all to visit the Global Ambition website, details of which can be found on your screen now, to go back and watch these recordings if you haven't done so already. We have allowed a generous amount of time for questions and answers at the end of today's webinar. So please do pop your questions into the chat box, and we'll try to get to as many as possible today. So now I'd like to take the opportunity to introduce each of our panelists and give a brief overview of today's agenda. As you can see, each panelist will give a brief presentation at the start of today's webinar, which will be followed by a Q&A panel discussion. So firstly, I'd like to welcome Dr. Sam Shah. Sam is a clinician, digital health advisor, and one of the leading voices in digital healthcare. Sam currently occupies the role of Chief Medical Strategy Officer at digital health startup Numan, and is the founder and director of the Faculty of Future Health at Ulster University. Sam is also former director of digital development for NHS England and NHSX. Sam will give his perspective on the NHS, the clinical user view, and some insights about consumer digital health in the UK. Sam, you're very welcome. I'd also like to welcome Andy Kinnear. Andy is a leading digital health expert and former NHS CAO with over 30 years experience working in the NHS. Andy has been a vocal proponent of NHS digitisation and a key figure within both the NHS CIO circuit and digital health networks. Andy has held many high-profile positions throughout his career, including Director of Digital Transformation at NHS South Central and West and Chair of BCS Health and Care. I'd also like to extend a warm welcome to 2 of our Enterprise Ireland clients today, Sonia Neary, CEO and founder of Wellola, and Niall Rafferty, founder and CEO of Medxnote. Both Sonia and Niall will give their advice and insights from their own personal experience accessing the NHS as an Enterprise Ireland client. I'd also like to welcome Martin Bell. Martin is a good friend of Enterprise Ireland and has been working with many of our clients for the last number of years, providing expert advice to our clients on the NHS and the wider UK healthcare landscape. as well as offering more strategic advice on the market access, entry and growth strategies, and much, much more. Martin is also a former board level CEO in the NHS and former Deputy Managing Director of EMIS. Martin will be chairing today's panel discussion. So I do encourage you again to pop your questions into the chat function. So without further ado, I would like to ask our panelists to turn off their cameras, please, and I'd like to introduce Sam to the floor. So Sam, the floor is all yours.
Hello, good morning everyone, and Peter, thank you very much for asking me to join and for your warm introduction. It's great to join Enterprise Ireland and share with you some thoughts. So for most people that are familiar with the NHS, you'll know that it exists across the 4 nations within the UK, and it's one of the largest publicly funded health systems in the world, spending almost £166 billion annually. And in England, that's about 143 billion pounds. And what that really translates to is a lot of activity that takes place by a lot of people, clinicians, citizens as patients using the system. And each year, the NHS deals with almost 340 million people in primary care and another 100 million plus in secondary care. So that's a lot of patients that have transactions, interactions with the NHS, with clinicians every single day throughout the UK, but particularly in England. But health tech has not always had an easy run or a convenient story in the NHS, and certainly not in England. There's been multiple iterations of initiatives and attempts to try and digitize the NHS. But I suppose some reflections on that. The first thing that we often notice is that when these initiatives take place, they're not always user-centric, not always around the needs of the citizen, and not always around the needs of the clinician. And certainly as a clinician, having worked in the system, one of the challenges is using frictionless software, frictionless devices, and those things that make lives easier, save time, but are also safe. And that's often a theme that will come up again and again through healthcare technology in a system like the NHS. But areas that seem to be growing, and certainly have grown in the last few years, around digital health and infrastructure technology, telehealth, telemedicine, and connected devices, and especially the space of apps. And certainly an area that I didn't think would grow so rapidly has grown almost infinitely in the last 12 to 18 months in an environment like the NHS, with more and more applications coming up all the time, but not without their challenges. The things that we need to get right around privacy for the individual, clinical safety that affects both the patient and the clinician, and at the same time making sure that we have the right model in place of integration, whatever that might happen to mean. People often ask me where to start, and having certainly been in the center of the system, I would actually say that's the last place to start. The center of the NHS often gives out direction and policy, which is really useful, but actually where these things take place, where it matters, is the interaction between clinicians, citizens as patients, at a local level. So I would always suggest start off with the clinical problem, start off with the citizen problem, and try and solve problems locally, but perhaps align to national policy. But hopefully we'll discuss that a bit more later on. Thank you, Peter.
You're muted, Peter.
Oh, thank you, Sam. Thanks a million. And I now just pass you over to Andy.
Oh, thank you. And yeah, thanks, Peter. And really great to be here. I've got to say, just up front, it's mega disappointing not to be able to come over to Ireland. I like to come over at least once a year and do a proper quality assurance check on your Guinness stocks, and it's disappointing not to be able to do that this year. Thanks for an opportunity to come and to talk to you guys, and sort of just to sort of build on what Sam was saying. I thought I'd sort of begin and describe three C's I've witnessed over the last year, and the sort of impact that they've had on the digital health and care space within the NHS, because I think it's significant. So the first one, unsurprisingly, has been COVID. You know, it's dominated the planet, hasn't it? Let's face it, for the last 12 months. But it's been a really interesting dynamic, I think, inside the NHS. You know, in many ways, it's it's begun to change the landscape around the digital conversation in many NHS organisations. Frankly, we've seen uptake and adoption of digital solutions at a rate that many CIOs would have given their IT for previously. And I think there's been some really interesting changes. So firstly, the prominence of technology within the delivery of healthcare has been given a mega boost through this pandemic. The fact that so many ways of working have been changed as a result of COVID has actually created a landscape in which promoting digital solutions and just getting people to think about doing things in a different way has been a real bonus, I guess, a kind of silver lining on the darkest of clouds. I think the second thing that's happened, although this is starting to tail away a little bit now, but certainly did for a good chunk of this last year, has been a huge reduction on the bureaucracy and the sort of heavy procurement processes that we saw that would often make relatively agile digital delivery difficult. And so I think it's quite interesting, when needs must, people really do work out what really matters and will sort of move that forward. But I think the most pleasing aspect has perhaps been the focus the digital story has had at board level. And so, Sam was right to reference those local organisations. That's the place where healthcare takes place and where patients get treated. But often getting the digital story in front of a chief exec or a board of an NHS organisation at a local level could prove to be something of a challenge. I've had more conversations with chief execs in the last 12 months than I probably did in the previous 12 years. And it's a sign that the sort of boards are waking up to the digital opportunity through COVID. I think my second C would be complexity. This is a deeply complex organisation. The NHS is actually 8,500 separate legal entities, and at times the only thing they've really got in common is the logo. And there's a real danger that you can sort of lose yourself in that morass. You can get kind of bogged down in trying to find out who's really important and what really matters. I think one of my real tips on that is honestly, don't kill yourself trying to understand it. I've been in it 30 years and I couldn't navigate parts of it. It's a very, very complex labyrinthine system, and actually in reality the real skill is working out who are the actual key characters you need to get to talk about your particular narrative. So I would kind of say respect that complexity, but don't fear it. It is navigable, and you can with the right help and with the right support you can kind of find your way into that system relatively easily. And then my last C really was around is confidence, because what I think we've seen certainly in the last year is a real newfound level of confidence around digital, both from the vendor community who are bringing forward innovative and quite exciting digital solutions and confidently presenting them to the NHS. More importantly, I think we're seeing more confident vendors, more confident NHS organisations who are now have got real belief and confidence in their own ability to transform the way in which they do things as a result of digital solutions. So I would sort of, taking those three things together, the COVID wave will slide off to the side, but it has changed the dynamic. The complexity will always be there, but don't fear it, and come at this challenge in a confident manner, because I think increasingly you will find customers the other side who've got the confidence to take forward your innovative ideas in an exciting and vibrant way. Thanks, Peter.
Thank you, Andy. Thanks a million. I'll now pass you over to Sonia Neary, founder and CEO of Wellola.
Hi, good morning. Thank you very much, Peter. I have a couple of slides here just to kind of give an intro to what we're doing at Wellola. I'm going to spend pretty much just 5 minutes talking a little bit about us and our company and what we're about, and also our experience personally of sort of trying to tackle the NHS as an Enterprise Ireland a company based in Ireland moving into the UK. So very briefly, I'm a physio by trade. I'm the CEO and one of the co-founders at Wellola. We're based in Dublin, and we're a digital health software firm that builds patient portals and patient-facing services at scale. Our vision is all about contributing to an ecosystem where only the sickest are sick are hospitalised, and we aim to do that by giving clinicians, from sole traders to hospital trusts, the tools to not only securely care for their patients remotely, but also to keep their data safe while their patients are not on site in a hospital or clinic. Next slide, please, Peter. So pre-COVID, the issues and costs related to poor communication in healthcare were sizable, and taking the NHS as an example, for 2019, they spent about 100 million on post, lost about $1 billion in non-attendance, in patients not showing up for their appointments. Add to this, there has been a move towards and a mandate towards delivering a kind of a digital first front door, or a digital front door agenda in the NHS, giving patients the means to sort of access their records and transactional services, supporting self-management of care, and obviously layering on top of that the issues that arose with COVID-19. There has been a greater demand for remote care delivery. And next slide, please. So our solution is a secure communications tool with multiple modularized functionalities. It works, as I said, from sole traders to hospital sites, and it works across both public and private sector, offering savings not only in the simple administrative things like posts and appointment management, but also self-management tools to self-care for yourself at home and receive care securely through messaging and video consultations, etc., through our solution. Next slide, please. So in terms of our current customers, we began with a subscription as a service product at wellola.com. Many of the sort of 750 or so clinics and SMEs that utilise that platform are utilising it primarily in Ireland and the UK. And we have a couple of resellers. One is in Italy and they work with physiotherapists. Another is in the UK and they work with counsellors and psychotherapists. And then we also service what we call the third sector, so sort of charities that service marginalised in our society, such as the homeless or the vulnerable older citizen. And more recently, and thanks to the support of Enterprise Ireland and our collaboration with Martin Bell, who's here on this fantastic panel, we are working to integrate with electronic healthcare records in the UK. So we were a sort of a standalone solution, but our solution is designed with what they call FHIR HL7 APIs to talk to other systems and integrate and interoperate with what's available already incumbently in the UK. So if I just move to the next slide, please, Peter. And I'm going to slow down a little bit. I just wanted to sort of whiz past my introduction. But if you're a company like ours and you're looking to move into the UK, there's, I suppose, a couple of considerations. Some are very obvious, and some are, things that we learned along the way. So, for example, routes to market. Most companies, if they're looking already to scale from Ireland to the UK or from wherever they're based in Europe to the UK or globally indeed, they already know their model. Are they directing their product directly to the consumer? If you're a digital healthcare software product, you might look at connecting with Orca, who do review kind of consumer-facing applications and put a sort of a quality assurance mark on consumer-facing healthcare applications in the UK. If you're business to business, again, it's very important, I think, to understand who might be a potential route to market there. Are you directly selling to sole traders or professional bodies, healthcare trusts, etc.? And is there potentially a partner who already has that customer base that you could liaise with or complement in some way? And then lastly, obviously, the kind of business to government route, which we've done quite well in Ireland. And again, I'm sure that the knowledge from Sam and Andy would be able to be imparted in terms of the business to government's route, which are relatively complex and probably the more challenging option in the NHS context. So then when you're looking at procurement, and something that we don't really have in Ireland, I suppose, is this kind of framework model whereby digital healthcare or medtech products can, or companies can apply to be listed on a catalogue where you are a supplier and you meet certain standards. And therefore an NHS buyer, as I said, a hospital or a trust can look at that framework, has a budget for that framework and can choose a supplier from that framework. So I think it's really worthwhile trying to learn as much as you can about which framework is most appropriate for the product that you're bringing to market. The other option obviously is the kind of conventional tender websites, which obviously, you know, post the kind of procurement that's on offer, and you can respond. Typically, you know, ideally you would be involved in a sort of soft market engagement stage. By the time typically it goes to, you know, public advertising, sometimes a provider may have been, you know, chosen, and such is human nature. But it is, again, worthwhile looking to see what sites might be the sites that are appropriate for you, and popping on the correct alerts to get, you know, identified when these things come up. And as I mentioned there previously, the business to business route, or the business to government route, it's very helpful to really explore the market and really kind of investigate what partner could be appropriate as a route to market for us, because sometimes you can avoid the really complex procurement cycles if that partner already has a contract with a trust or a site and they want to switch on your service. It can often come with something as simple as a change request notice in that contract. So that can really help when you're looking to get to market quickly and capture a good foothold in the market at relative speed. Then obviously there's the compliance side of things, which if you're in healthcare, you're familiar with this most likely, and I don't want to teach you to suck eggs, but there's a couple of things again that we didn't know, kind of exploring the UK and how things were differently done. For example, you know, we need to register with the ICO. Information governance is hugely important in the way you attend to infrastructure and hosting, and a real solid look at your application if you're in the software side of things with a clinical safety officer who would meet things like DCB 0129 compliance for your product, etc. So it's very important early on to educate oneself about the regulatory compliance side of things. Obviously then from a technical perspective, being a patient-facing service provider plugging into sort of the infrastructure in the UK, I have to say there has been huge support from NHS Digital for us. There's a very cleanly documented process and procedure. You apply for supports, you have to meet particular standards, you're given what they call sort of SDK or testing environments to test your APIs, build a prototype in. It's really fantastic, and again, something that isn't yet here in Ireland. So I would very much engage with NHS Digital as early on as you can. And understand things like, do you need NHS login on the front of your system for single sign-on? What systems do you need to plug into, and what are the routes to doing that? So things like IM1, for example, if you're working to plug into primary care solutions, and the health and social care network connectivity that's required to do that. So again, there's a lot to learn, but there's a lot of supports both from EI and Martin and other consultants to advise on you know, what you need to know before you put a toe in the marketplace. Really quickly, and again, this might come up in the chat later, but some of the supports that we found, obviously Enterprise Ireland is a no-brainer. They've been fantastic for Wellola. They've given us a huge network, and the consultancy, as I mentioned before, through Martin. Other funding supports, we've got Competitive Start Fund, High Potential Startup Unit funding. Also the Market Discovery Fund, which is fantastic if you're looking to do some sort of early market research, you know, meet potential partners, etc. They can support funding there. There's obviously the Research Centre, which has been amazing in terms of giving us insights before we even looked at setting up in the UK. Equally, there's other bodies. Oh, sorry, and I meant to say, you know, if you're kind of at the time when you're travelling, we were able to ask for office space in the UK Enterprise Ireland office to meet with clients there. So that's a really fantastic. It's on Shaftesbury Avenue, and it looks very nice. So again, there's other offices that can be availed of when travel is allowed again, I guess. Intertrade Ireland have some fantastic supports as well, from funding supports where you're exploring, you know, selling into the UK for the first time, to their competition seed corn, which again is good both from a, you know, promotional and branding perspective and a funding perspective. SBRI is a really nice gateway if you're a healthcare platform looking to pilot or test your solution in the NHS. There's funding and you're partnered with potential sites. It's a competitive process, but worthwhile looking at. And EIT Health, again, have also been a support to Wellola. They have, again, a huge amount of funding, networking, supports that open up doors for you to enter conversations with potential buyers and to validate your product. In a new market, it's always worthwhile testing because the market will have different demands. The Department for International Trade are also really helpful, and we linked down with them this week. We have, for example, a subsidiary in the UK. We're looking to make a few of our first early hires in the UK, and they can really help with sort of a soft landing and educating you on where to go and where to look for supports. Obviously then in the Irish context, the Health Innovation Hub and the digital transformation team at the HSD have been really helpful for us in validating it locally before going over the pond. So yeah, I look forward to your questions. If you could just change the slide there, Peter, my contact information is there as well. So if anything comes up afterwards, I'd be only delighted to support in any way I can. Thank you.
Thank you, Sonia, for that fantastic presentation, very in-depth, and thank you again. I'd just like to introduce now our next presenter, Niall Rafferty. Niall is the CEO and founder of Medxnote. So Niall, over to you.
Thanks, Peter. Hello, everybody. I'm just going to really tell a story. I know Sonia went into a lot of detail, so this is more the Medxnote story. So first slide, getting it right, lessons and advice for digital health companies entering the NHS. So just next slide. Or else you could say it's failing slowly since 2013. So what I mean by that is, you know, in healthcare or in technology, you listen to Silicon Valley podcasts, they talk about failing fast. You know, you build a product, you test it, you get it out there quickly. If it fails, you reiterate. You can't do that in healthcare. Healthcare, because of clinical safety and information governance, it takes much longer than you think. So every iteration, I think, takes about 1 year to 2 years of your company. Next slide, please. So I think it's really important to have a vision of what you want to do. So my vision, I was a radiographer, I managed X-ray systems, and the big issue I had was, you know, if a clinical event happened in the radiology system, say like an urgent unexpected finding or an urgent finding, we had to page the doctor to get that information out, and the doctor, obviously, once they got the page, they logged onto a PC, they looked at the report. So we had this very archaic kind of PC-based workflow using pagers, and that was the vision, and it still is the vision of the company. Next slide, please. So I think then, talking about vision as well, it's what you want for your company. Are you just in it to make money, so you want the dollars, or are you in it to get your application or your innovation out to loads of users? Or are you going to try and do the enterprise sale? And I suppose that's what we're talking about here on the webinar. But it's interesting, in the early days, we had competitors who, instead of going down the hard road of trying to sell their innovation to hospitals, they went out and they gave their application to users. So they got loads of junior doctors using it. So these are the likes of Silo, Forward, Pando. They went back to VCs and they said, look, we've got 10,000 users in the NHS, and they got millions of euros in funding. So you got to think there are alternatives to just the hard, slow sell as well. So it's just important to bear that in mind. We went down the enterprise route because obviously we wanted to connect our system to existing clinical data, and then we felt we had to go through the formal channels in the front door. Next slide, please. So our first app was an iPhone and Android app. It was to replace WhatsApp. So it was WhatsApp replacement. These are some of the screenshots. Next slide, please. So we got it into the Blackrock Clinic in Ireland. So Blackrock is probably one of the most prestigious private hospitals in Ireland. Interesting, private hospitals in Ireland don't pay you very much money, so you never got more than 20 grand out of any of them. But anyway, we had our app in Blackrock. It went really well. Everybody was using it, and we got lucky. So how we got into the UK, our story starts in the Blackrock Clinic. Blackrock Clinic were looking at replacing their electronic medical records. They had a consultant, Larry Murphy, in. He was there at the same time as me. We met him for a coffee in the canteen, and he said, look, everybody's using Medxnote as a WhatsApp replacement. I've got a new gig in St. George's in London. I'm going to be the CIO and the CIRO, and so I'm really interested in you guys coming to St. George's. So next slide, please. So from Blackrock, we followed Larry to St. George's, and we got into St. George's Hospital. Obviously, we had to convince everybody else, but at least Larry gave us that foot in the door. He knew that we were doing good work in Blackrock Clinic, so he could give us a reference, and so we got into St. George's, and we got a lot of people using our app, and we got some money through we were on the G-Cloud framework. As Sonia was saying earlier, it's important to be on a framework so people can buy from you, so we were on G-Cloud. St. George's bought us, they implemented Medxnote as a WhatsApp replacement. Everything was going good, and then WhatsApp became encrypted, and a lot of as I said, our competitors at the time got funding, and one of our competitors, Silo messaging app, was in St. George's in the orthopedic department. So while we were the bought product for St. George's, used by a lot of people in the hospital, the orthopedics team, that one of their surgeons was an advisor to Silo, so he was encouraging everybody in George's in the orthopedics to use another messaging app through the freemium model. So that was very interesting. So for us, we kind of looked at the market again, and we saw, WhatsApp's is encrypted. There's a lot of competitors. Well, let's go back to our vision. What were we trying to do? So next slide, please. And really, that was about connecting information from clinical systems into doctors' mobile phone apps. So we built our first HL7 Firebase bot, so we could get lab results direct from the lab system into the messaging app. You get a notification in your messaging app. You could view that notification. So you can see here, this patient's got influenza A, so RNA detected. So now we had that, and we went to conferences in the UK. And next slide, please. And luckily, at a conference, we met Adrian Byrne and Joe Watts from Southampton Hospital. We showed them what we had. We showed them our demo of our bot that I showed you previously, and they really liked it. And Adrian he got us from day one. He said, look, everybody's talking about WhatsApp replacement, but for me, it's getting data from clinical systems into a messaging app in a secure manner. So we were lucky enough to win a procurement in Southampton. So now we had our first GDE, and we had our first reference site in the NHS. Next slide, please. One of the things then we noticed was that Microsoft Teams was getting really well. It was starting to get popular in the business world, and we could see kind of into the future that everybody was going to be using Teams. So about 2 years ago, we had a sit down with Southampton. We said, look, we know you've procured a Medxnote iPhone and Android Messenger app. We want to move everybody to Teams. So we moved everybody to Teams in Southampton. Next slide. And now we are at the intersection. We're the man in the middle here in connecting the clinical systems to Microsoft Teams. Next slide, please. So this is just a screenshot of what Medxnote looks like on Microsoft Teams. You can see here a neurology team receiving a COVID-19 alert from the lab system into Teams. Next slide, please. We now have 2 apps on the Microsoft App Store. So we've got Medxnote Messenger, which is our Medxnote, it's our bot, and then we have our new integration to Microsoft Planner. Next slide. And now we have 3 contracts in the NHS. We're in Southampton, Hampshire, and Portsmouth, and through Enterprise Ireland and France, we've got our first French contract. So we're still relatively small, but we're in a good position now with our new partnership. We're a strategic Microsoft partner, and we have opportunities worldwide. Next slide, please. So the final thing I suppose I wanted to say was it's important to know what your vision is. For us, it's been a long road. We've pivoted left, pivoted right, but we stayed true to where we were going in terms of our vision. I think we've found that now with our partnership with Teams and Microsoft, and so it's bright days ahead for Medxnote. So thank you very much.
So Niall, thank you very much. And can I just thank Sam, Andy, Sonia and Niall again for really useful insights over the past half an hour or so. Can I also remind all of you, and there's many of you on the webinar, and some of the names I even recognise, so I know you're not shy in coming forward. If you could ask your questions, we've got this expert captive audience for the next half an hour or so. So please fire your questions in. From my point of view, the more complex and difficult they are to answer, all the better for the asking of them. I'm going to start with one for Andy, if I may. So Andy, you mentioned earlier about how you've perhaps seen a bit of an easing in terms of getting access to C-level exec type people. For Irish companies coming over to the UK, perhaps without expertise or guidance and just sort of rocking up and looking at the UK, what would be your sort of top advice for getting in front of the right people?
Well, I think the very first piece of advice, actually, Martin, is to work out where the product you've got is going to be most effective and most likely utilised. So don't fall for the, Sam warned about this. Don't fall for the idea of getting yourself in front of somebody at NHSX and thinking that that is instantly going to lead to England-wide sales of your, and some mega contract that will get adopted across the NHS. That does occasionally happen, but it is pretty rare. My feeling would be to focus in on, a bit like Niall's just described, focus in on a few organisations where you've got a set of criteria that looks a bit like this. There's a digital leader who grasps your technology and understands the difference it can make for their organisation. There's a clinical digital community leadership who have got enthusiasm to try new things and do things in different ways. There's a sort of enough funding to get the journey started without necessarily giving you the kind of, all singing, all dancing 20-year, perpetual license type contract level agreement, but enough to get underway and get yourself to the point where you've got, a genuine reference site, one or two places where you can actually point at, so that, because the first thing all the CIOs will say to you is, are you doing this anywhere in the NHS? Where have you deployed it? Have you done it over here? They'll want to see that that evidence that this thing works in an environment that they recognise. So my feeling would be, whilst it might be tempting to try and go for this, mega deal, in reality they're few and far between. I would concentrate on, some core business with some relatively small group of clients, get it working, prove your product, refine it in the way Niall and Sonia have sort of described through the processes they've gone through, and build out, adopt a very strong kind of land and expand, strategy. Actually, once you've got that site you can point at and take others to go and see, then there's every chance you'll grow from that base.
Thanks, Andy. Really useful. And perhaps in a similar vein, but maybe focusing in on one particular area, for Sam, this one, we've got a question about what are your thoughts about how valuable AHSNs are as a route into the NHS?
Well, so for those people that don't know, AHSNs are academic health and science networks, and basically they're a hybrid of NHS England as their funding body, and they are part local as well in how they exist, and they exist all across England. And they're really designed to try and promote some innovation adoption. Now, I have a slightly challenging view in that, people have different definitions of innovation. But what I would say is AHSNs, like any other part of any health system, are mixed. And it's really about who you connect with and who you form a relationship with. So they're useful in terms of having some visibility, some understanding of the local players in the local market, and they might give you some market access. So it's good to engage with them, and they might introduce you to the right people, but you'll still have to do the hard work. And where they may be useful in opening some doors, you'll still have to demonstrate your product market fit, as Andy mentioned. I think Sonia had a really good example of how she's engaged with all parts of the system. So they're useful, they're helpful in terms of getting some visibility, almost some PR, dare I say it. But in terms of the hard work of convincing someone that you've got a right product, it fits in that part of the market, and that you've got something that's useful to the organization and their patients, you'll still have to do that and make that case. Be careful though. Be careful, because AHSNs, when they may be stuck, might push you towards the center of the NHS, which is useful for policy, but you're not going to get a sale from them. And it's unlikely that you're going to be solving a national program. So I would say helpful, but just be careful.
Thank you, Sam. Question for Sonia. In terms of before you came to the United Kingdom, when you were sort of evaluating, what did you feel were the pros and cons of the UK market in terms of moving your solution from expanding from Ireland into the United Kingdom? What did you feel was good? What concerned you?
Yes, so the pros were very strong in that, again, comparing Ireland and the UK, which are kind of the two markets that we're mostly playing in, there is an infrastructure, technologically speaking, that one can, integrate and interoperate with in the UK that we don't have here. From a kind of a very high level, from a kind of a mandate level, a legislative level almost, there is a kind of a digital front door policy at the NHS. There is a drive towards digitisation that, again, really began here more when COVID, unfortunately, it was the kind of driver in Ireland, but that has long been the case in the UK. So from a kind of a mandate perspective, from an adoption perspective, from a technological capability perspective, there was a lot of pros. I suppose the cons are that, with Brexit happening, we had to sort of set up an office, a UK subsidiary, have a UK accountant, a UK lawyer, build out a UK team, and that can be challenging, from overseas. But again, that's where Enterprise Ireland and yourself, Martin, and I know I keep alluding to it, but you have really been instrumental for us in supporting our move. And Niall also, who introduced me in the first place to your consultancy. So, the pros are very obvious. The cons are there is a bit of a body of work to be done, setting up in any new jurisdiction. And obviously that whole body of work that goes into really researching the market. I thought we know what the NHS was, and then we spent a couple of days with you and learned, it's a very complex machine, CCGs, ICS, different purchasing and procurement bodies, and I think it's important that one educates oneself as much as possible about that before exploring the market.
Okay, thank you, Sonia. I'll come to Niall in a moment. A question for Andy and Sam. Feel free to answer in that order or otherwise. Is there any absolute regulation, any absolute standards that a piece of software, a piece of digital health coming to the UK market, and of course it's multiple markets, multiple sectors, different countries, devolved nations, has to meet? And we're talking about things like ISO 27001, I know Sam mentioned clinical safety earlier. Is there anything that absolutely has to happen before you can even unwrap it and place it into a healthcare setting?
Do you know what? Off the top of my head, Martin, I would need to go and investigate to know exactly whether, to what extent that stuff is absolutely mandated. And I would sort of refer to Sam's answer about it. In some ways, it varies. One of the things that you'll see in certain organisations certainly is a varying attitude to, to the degree to which some of this is, applied. I mean, one of the things I thought was an interesting journey to be on a few years ago was when nationally they tried to mandate a set of interoperability standards through something called the Itk Interoperability Toolkit, and pushed it out and said to all the vendors, you guys need to adopt all of these standards. And they said to all of the NHS, you need to only work with vendors that have adopted these ITK standards. And you wind the clock for 18 months, and hundreds of contracts have been signed over that period where the NHS ignored the ITK standards and the vendor, ignored them as well. So I think a sort of probably a healthy skepticism to the need to have all of those standards in place is there. I think when it comes to technical standards, I'd probably point people towards Sonia mentioned Orca actually, and that was a really good reference. Another entity that I point people towards is an organisation called Interopen. What Interopen do? They're a membership body, and vendors are encouraged to join and partake in the development of those technical standards. So the response to ITK and the failure of ITK around technical standards has really been to say, well, okay, why don't we work with our vendor community hand in hand to develop the next generation of technical standards, the fire and HL7 and all of that element. And Interopen is the body that are orchestrating a lot of that activity. So I think if you want to really get into the, okay, what are my technical standards space, then join Interopen and participate in their hacks would be my recommendation.
Yeah, just following on from that, there are of course some standards that apply across the whole of the UK, especially device standards. So if anything that you're doing gets classified as a medical device or software as a medical device, then that is an absolute that you should really fulfill. Now, the reality on the ground, as Andy quite pointed out, is there'll be degrees to which this will be adopted and interpreted. But of course, the aspiration is medical safety through device regulation. At a country level, it's really England that has most of the regulation in place for its health service. Scotland, Wales, Northern Ireland is slightly different. But in terms of England, there's a clinical safety standard that for an NHS provider that have to fulfill. Data Protection Act exists across the whole of the UK for privacy, and security isn't actually enshrined in law in the same way as it is in other jurisdictions. So it almost goes hand in hand alongside data privacy, but actually it's inferred there that security is of course another standard. Of course there are regulatory standards, but it's not actually enshrined in law in the same way. So there are standards. It's important to fulfill them, but agree that there'll be some local variation as to how they're interpreted, organisations such as Interopen, and there are others as well, Orca, will help get there. And there's lots of advice available from people like Martin and his team as well, who will help, and speak to others who've been through the system, because they'll tell you some of the challenges they had. But accept the fact that you'll go to 5 different NHS organisations, and they probably expect you to fulfil 10 different sets of standards between them. So don't be surprised if sometimes you might know more about the standard than some of the organisations you'll be approaching.
Thank you very much, and I'll send out the brown paper envelopes around later. The question for Niall then. So you've obviously been successful. You talked about your story, Niall. Tell me about some of the, if you could, some of the complex, Andy talked about the complexity of the labyrinthine nature. What are 1 or 2 of the things that you would have changed that you came up against that would have made your entry into the NHS easier?
Well, one of the things, as I mentioned at the start, is a lot of our competitors at the time who were doing WhatsApp replacement gave the app away for free, got loads of doctors using it, went to venture capitalists in London saying, look, we've got 10,000 doctors using our app, give us a few million, and they got 3 million, some of them got 10 million. So maybe that was, like, in hindsight, you could have, but then I would have been kind of lying. That wasn't really our vision. Our vision was to connect the clinical system. So, but that was one thing. I think looking at GDEs, like targeted, like, you know, we wanted to meet Adrian Byrne at that conference, you know, because he was the GDE for Southampton. We wanted to meet David Wallaker. We ran a pilot up in Liverpool. You helped us get into Merseycare. We're another GDE. So that was really important. Looking who's got money, and I like what I think it was Sam said earlier, or maybe Andy, that looking at what personality is going to take a risk, because not all CIOs will actually take a risk on a startup. There's only a certain breed. Now, it's very hard for us to, maybe somewhere like yourself, Martin, could point company to that type of person, like, you know, you got to speak to like an Adrian Byrne, or maybe a David Wallaker or an Andy, or somebody who's going to actually take a chance on the startup. Because I find the default position in healthcare generally all over the world is do nothing. It's like they used to say, nobody got fired for buying an IBM, nobody gets fired in healthcare for doing nothing, and that's, you got, you know, maybe that's slightly unfair, but you got to find out people who want to do something, who want to change, and luckily we found that in the NHS, which I think is good. I remember, sorry, one thing. Previously, I was at an Enterprise Ireland conference before your time, a few years ago, and they said, look, the NHS is impossible, forget about it. Maybe get one site, get it as a reference site, and use that to sell to America or to sell somewhere else around the world. So that was the advice I got. So before, so like, yeah, so that's, I think I've answered the question. Sorry.
Okay, brilliant. And same question to you, Sonia. What would be the kind of complexity, the barriers that you come up against that you would, 1 or 2 of those that you would have really liked to have changed?
The barriers, wow. It is about understanding the landscape, and it is about sort of finding that first, as you say, validation. I think, you know, the first question, as Andy said, you get asked is, where are you in the NHS and who's using you? And it's getting that first foot in the door. And so that's why I think for us, certainly the partnership route has really helped, because you can kind of collaborate with that partner who has, you know, a foothold in the market, and you're adding an ancillary service that they don't have. That can be a very, I suppose, a soft landing approach when you're first trying to enter the market. And then equally those kind of opportunities for innovation like the SBRI, like EIT Health Connectivity, etc. It's about getting app pilot site as best you can, and that can be really challenging. So for us, we did have to validate to a certain extent in Ireland, and as I said, COVID accelerated that, and our platform that we released for the Irish equivalent to the NHS here, the HSC, really supported us when we tried to take it into the NHS. You know, that's a really good reference for us, I guess. So I suppose it's about having references, a couple of early pilot sites, before you can really think about growing. And then, of course, you don't know what you don't know, and that whole piece about frameworks. I remember kind of accidentally at NHS Expo, Niall mentioned cloud, G Cloud. I was like, oh, what's G Cloud? You know, and I sort of jumped on that, and we applied and got onto it. You know, but it is about sort of networking as much as you can, learn from providers that have done this ahead of you, and what worked for them. So yeah, I think the key barrier is what you don't know, and trying to inform yourself as much as you can.
Thanks, Sonia. Double-headed question for Andy and Sam, if I may. Next, there's a question here, and I'm just going to expand out the actual question. So for Sam, if you're going to talk to NHSX or NHS Digital, one of those central acronyms, who would be the people there that would be, in quotes, sort of responsible or at least heavily interested in startups and new innovations. And then same for Andy, if you're actually going to local organisations who, in the main, as you said, are the ones who buy, who would be the startup director that you should be going to talk to?
Well, if it was the central organisations, somewhere like NHSX, then I'd probably certainly start off with the Chief Digital Officer of NHSX and that team. So that's at the moment Tara Donnelly, and there's a great team there, Lisa Hollins and Breed O'Brien and others there that would be good to discuss startups with because they have an interest there. There's also the Accelerated Access Collaborative within NHS England that's aligned to that oversees the system. Of course, there are good people there as well that have responsibility for innovation across the NHS. So they're also very useful. But remember, it goes back to something Andy mentioned, Niall also covered it, and I think Sonia did too, which is also about personality. So you'll find when you look at the conference circuit and elsewhere, you'll see other people from central organisations that have an interest. So you might find the Director of Digital Transformation nationally or the Chief Information Officer, they also have an interest. So certainly the Chief Digital Officer, but also some others that have shown an interest that might be your opening to get market intelligence, but also understanding the system. For NHS Digital, they're less involved in startups directly, but sometimes you'll find there are people there who have an interest. So certainly in the citizen-facing technology space for NHS Digital, there's a team there, but also the team that's responsible for, Sonia mentioned them earlier, but around the developer standards, they're also a good team to connect with because they'll help you if you're a startup trying to work in the NHS. Andy.
Oh, thanks, Sam. And yeah, Martin, yeah, if only, isn't it? If only you could go to an NHS organisation and say, I want to speak to the Director of Innovation and the person responsible for doing all of the digital transformation across this organisation, and know you've got single door entry into that world. It's just not that easy, is the short answer. What I would say though is I think there are some critical people that you need to sort of ultimately get to be successful. It sort of depends on the scale, but there's a really critical access in most NHS organisations that exists between the people who lead in the clinical space and the people who lead in the digital space, very often traversed by people like Sam, actually, clinicians who can speak a bit of both languages, or certainly speak the clinical language and can speak enough of the technology language to be in that space. And I think where I've seen innovation be most successful, it's been vendors who've been able to make friends with people inside those NHS organisations who traverse both of those worlds: the clinical CIO, the Chief Nursing Information Officer type world, and then the CIO, the digital world. Ultimately, one of those two characters is going to be your sponsor or your economic buyer, and chances are it could be either side of that. It may well be that if you've got a clinical application, then it will be the clinical team that will actually sponsor that. They'll be demanding it. They'll be tamping on the desk to say, give me this thing, like, we must have it. It will transform the way we work. And chances are it'll be the IT budget that will be bankrolling it, and a CIO will be actually wanting to understand, okay, well, I get your demand, but how does it fit with the rest of my architecture? How does it fit into the rest of the other 300 or whatever it is systems that we're running across this organisation at the moment? So I kind of, if I was focusing on people, I'd take a bit of Niall's advice. I'd kind of focus in on okay, who's the digital leaders that are driving change? Rock up at a conference, go and buy them a beer, make friends with them, and sort of and work on those kind of individuals. It's not clear from the outside who that character is inside those organisations necessarily. You need to do a bit of fishing around to find out.
Okay, thank you very much. So a question, lots of questions still coming in, which I've answered a couple online, and we'll also try and answer others when we no doubt run out of time before getting to them all. But I'm going to start with Niall for this one. There's a question around, well, the question is around, is there a standard set of commercial terms for contracts? Is there a preference for how these might be structured? I asked this obviously kind of sort of prejudging the answer. I wondered what you initially, Niall, I'll go to you. What was your experience in terms of the contracting commercial arrangements and what pitfalls, complexities that might have thrown up for you from your side, and then I might come to perhaps Andy and or Sam from the other side.
Yeah, well, the first thing we did was get on G-Cloud. Actually, EI had a workshop a few years back on how to get onto G-Cloud. I think it was maybe G-Cloud 8 or 9 at the time. So it's very easy to get onto G-Cloud. Nobody gets rejected, so you should be on G-Cloud straight off the bat. You know, the second thing then interesting, like an example, when we were doing the procurement with our hospital recently, they didn't want to go through the G-Cloud framework, so we actually partnered with Softcat. So Softcat are basically on all the frameworks, and for a small commission, you can use their framework. So in that case, the hospital actually, they didn't buy direct from us, they bought from Softcat, and Softcat bought from us, and they took their commission. So there are ways around it. So if you're on G-Cloud and they want to use an alternative framework, I'd consider Softcat or a vendor like Softcat, who are an aggregator of frameworks, and so then that's not a problem. So I think frameworks, like Sonia said, are fantastic. They're really, really good.
Okay, Andy, thoughts perhaps from your side, the other side?
Yeah, I was sort of wryly smiling a little bit. I got in a bit of trouble about 4 or 5 years ago because I wrote an article saying what a miserable experience it must be trying to sell to the NHS, because I thought we'd just got ourselves bogged down in ridiculously complex procurement processes, and you know, we were so sort of heavy set on following the process that we were losing sight of the outcome. I thought, and at times, you know, we were losing people along the way, you know, good vendors and stuff who were just sort of saying this is just too hard to get through it all. And I think it's really reassuring actually to hear Niall say that about G-Cloud and about the frameworks actually, because I think those elements are a response in a way to that you know, that pickle we'd got ourselves in, and I do think we've begun to improve it. I still think at times that we wrap ourselves up in knots a little bit inside with bureaucracy and make it, you know, very, very difficult to get to the end point. I've certainly been on projects where when we've got to the point of contract signature, it almost feels like the end. You've had to work so hard to just get to that moment, and you're only really at the beginning. So it's, you know, it can be a bit, you know, a bit tortuous in that regard. But I think you're right, Niall. I do think it is becoming increasingly a bit easier to navigate through some of this. And thankfully, the NHS has learned that, you know, if we want innovative vendors working with us, then we need to make it a bit easier for them to get in the door, frankly.
Okay, and so I'm going to try and fit a couple more questions in, but perhaps shorter, pithier answers. And another one for Andy, I think, given your background, specifically in terms of startups focused on primary care. What would your advice be around engagement?
Well, again, same advice in terms of finding people, you know, innovative people. I think primary care's got a very strong track record of innovation, so finding innovative GPs is not that difficult. Primary care networks are now active and vibrant again and are beginning to, you know, shake things up in that space. You can find those geographies, but yeah, honestly, it fundamentally boils down to the people, Martin. You know that, and so I think, you know, finding big thinking innovators in primary care is not that challenging, to be absolutely honest. There's plenty of GPs out there looking to change the world.
Okay, sorry, go on, Sam.
I'll just add to that, in that, bear in mind, there's lots of companies trying to work in primary care. There's no shortage of them. So come along with something that takes us beyond where we are right now. And remember, there's not one model across the system. In some places, you'll be dealing with an individual GP practice. In some places, the primary care network. Other places, the layer above that, the CCG. And in some places now, it'll be the whole system. So there isn't a single model. And go to whoever that leader is that's probably, you know, shouting quite loudly about what they want to do about the front door to primary care, and accept that there will be a bit of variation.
Brilliant, thank you. Well, I'm getting the word in the ear from the producer in the gantry, so I think I will draw this to a close. Just to thank all four of you. Fantastic Q&A session. And thank you all online for submitting your questions. Apologies if we didn't get to them. And I'll hand back to Peter.
You're on mute, Peter.
Sorry, guys. So thank you, Martin, and thank you to all our panelists for taking time out of their busy schedule to join us today. That was an absolutely fascinating discussion, and I'm sure it served very useful for many of our Enterprise Ireland clients. Before we go, I would just like to remind everyone of some of the Enterprise Ireland supports that we offer. So firstly, I'd like to remind everyone of the Market Research Centre. The Market Research Centre provides market reports and insights for companies looking to explore new markets. They've kindly put together a list of reports on digital health, which are available through their website, or you can contact me directly. I'd also like to remind everyone of different supports we offer, funding supports, as Sonia alluded to, the Market Discovery Fund, as well as many other funding supports. So I would ask you to please get in contact with us if you're interested in any of these supports, or contact your DA directly. Finally, I'd just like to thank everyone for joining us again, and if you have any questions for me or any of our panelists, please do follow up with us, and I'll be happy to relay them. So thank you again for joining us, and enjoy the rest of your day. Thank you all.
Thanks.
Bye now.
Thank you.